Today we'll be discussing medical marijuana. In the medical and scientific community, in which it is known as cannabis sativa. Everyone knows of its benefits for cancer patients when it comes to vomiting, nausea, and increased appetite. Did you know that new studies have shown it to help people with neurological disorders such as post-traumatic stress disorder and Alzheimer's? During my research, I was surprised at all the diseases that marijuana can assist with. Many doctors support the use of cannabis as a means of providing relief to their patients. Currently, 16 states now permit legitimate clinical use of marijuana, but the DEA still classifies cannabis as having no medical use. And now we will begin discussing how marijuana has shown to help patients with neurological disorders such as post-traumatic stress disorder and Alzheimer's disease. Let us start with Alzheimer's disease. Alzheimer's disease is currently the sixth leading cause of death in the United States, affecting 1 in 3 seniors. There are an estimated 5.2 million Americans of all ages that have Alzheimer's disease in 2013, according to ALZ.org. 5 million of them are over the age of 65, and more than 75% of them will suffer from agitation. Agitation is the most common behavior problem in patients with this disease. Let me help you understand what this means. Let us picture a grandmother in her kitchen early one morning preparing some breakfast. In walks her daughter. As the grandmother turns to see her, she suddenly grabs the hot skillet, swinging it wildly at her daughter, yelling, "Who are you? What are you doing in my house?" This level of agitation is what many patients and their families deal with daily, an uncontrollable outburst of anger and fear. Scripps Research Institute in California has done research that shows THC, the active ingredient in marijuana, prevents the formation of deposits in the brain known as Alzheimer's plaques. THC is also more effective at blocking clumps of protein that can inhibit memory in patients with Alzheimer's. Cannabis was found to prevent the formation of Alzheimer's plaques in the brain more effectively than commercially marketed drugs. So by patients being prescribed cannabis, they are less likely to enter into these extreme agitations. Now let us discuss the second neurological disorder that can be treated by cannabis, which is post-traumatic stress disorder, otherwise known as PTSD. About 5.2 million adults nationwide and between 11 and 20% of veterans of the Iraq and Afghanistan wars are affected by PTSD. According to the National Center for PTSD, between 10 and 30% of people experiencing a traumatic event will suffer from PTSD, a condition in which the patients continue to suffer stress symptoms for months or even years after the event. Symptoms include reawakened trauma, avoidance of anything that could recall the trauma, as well as a psychological disturbances. One of the problems with the course of treatment that really hinders the patient's recovery is that the person is frequently exposed to stress. The present study, carried out by Dr. Arti Akramov and her research student, aimed to examine the efficiency of cannabinoids as a medical treatment for coping with post-traumatic stress. The first stage of the research examined how long it would take for rats to overcome a traumatic experience without any intervention. Immediately following exposure to the traumatic experience, the rats would not move back to the area where it happened voluntarily. But a few days later, after not receiving further trauma, they learned that it is safe again and moved there without hesitation. Next, the researchers introduced an element of stress. A second group of rats were placed in a traumatic experience and then were exposed to secondary stress. These rats abstained from returning to the traumatic area in the cell for much longer, which shows the exposure to additional stress does indeed hinder the process of overcoming trauma. The third stage of the research examined yet another group of rats. These were exposed to the traumatic and additional stress events, but just before being exposed to the secondary stress, they received an injection of synthetic marijuana in the amygdala area of the brain, a specific area known to be connected with the emotive memory. These rats agreed to enter the traumatic area after the same amount of time as the first group, showing that the synthetic marijuana canceled out the symptoms of stress. The study, carried out underneath the supervision of Dr. Ari Agrawal in Israel at the University of Hayes Department of Psychology, was published in the Prestige Journal of Neuroscience. Dr. Ari was quoted as saying, "The results of our research should encourage psychiatric investigation into the use of cannabinoids in post-traumatic stress patients." Now you should have a better understanding of how marijuana or cannabis can effectively help those suffering from neurologic disorders such as PTSD and Alzheimer's disease. Thank you for your time. Dismiss.